this is a subject that is taboo. In most Pakistani homes, parents don't discuss this issue with their children. When these students come to the medical college, they're totally ignorant about what constitutes sexual health. And I think the only opportunity they're really ever going to get is through their curriculum in the medical college.
हमारे इसमें जो करिकुलम में रिप्रोडक्टिव सिस्टम है और प्रेगनेंसी और सेक्सुअल ट्रांसमिशन डिजीज़ हैं, लेकिन इतनी डिटेल में इतना ज़्यादा और इससे उसमें लेवल पे नहीं है जितना कि डॉक्टर सिकंदर ने जो आहंग ने हमें नॉलेज जो है प्रोवाइड की.
When I was a junior in fact a student, what we underwent, myself and my of course the class full of it, that we used to have one of the chapters in our Ghanaian obstetrics books, and now also we have one of the chapters about sexual problems, like about impotency, like about decreased libido, like about all these issues. But in our topic of lectures which we used to have, that was the only chapter which was left behind. It was not even taught to us by our senior teachers. So that, from exam point of view, we always used to think that is the least important subject. Now, coming across so many practical problems of the females, like infertility issues, vaginal discharge, and AIDS and hepatitis, all these things, I feel personally that that was such an important issue, and why was it left behind was of course the matter of policymakers.
Sexual and reproductive health conditions account for nearly 2/3 of disability-adjusted life years lost among women of reproductive ages in third world countries, compared to about 1/3 worldwide.
If we don't know the sexual history, how we will explore the sexual history? And if we don't know the skill, then definitely we will not be able to explore the sexual health concern. And at the same time, if we don't have the environment, just like of the time, privacy, knowledge and non-judgmental attitude, we will not be able to maintain our comfort level, and the client will not be able to explore the sexual health concern. So I think the medical curriculum doesn't address these issues, and not addressing these issues, the management of the sexual health issues becomes very difficult, just like the partner management, contact tracing, exploring the relationship problem, couple counseling, referring the patient, and again the problem of the privacy and the confidentiality is not addressed in that.
We need to work right from the top to the bottom. It means that first of all we need to advocate it to the policy makers. If they are convinced, then only this sexual health part can be incorporated in our policies. And after that we need to provide intensive training to our service providers, and then we need to build this up into our medical curriculum.
We're talking about a change in methodology of teaching. So they need to actually practice taking a sexual history of their clients. They need to practice how to counsel their clients. They need to be told that they need to be given scenarios where their own values are challenged, and so that they if they're confronted with a situation where somebody comes in with like an issue and has a value which is completely different from theirs, they need to be able to respect that client's privacy, confidentiality, and not impose their values on that, and treat that person in a non-judgmental manner.
We held a workshop last year with Aahung, and it was very successful, very well received amongst the faculty, and we're planning to actually replicate this twice a year with the students as well, the final year medical students. So we felt that we should target them, everybody in the class who are the future doctors, GPs, gynecologists, whatever. If they have this basic understanding, they can go on, and if those of them who are interested in this they know where to come. that there are some professional bodies in Pakistan that they can approach and refer patients to.
एक्चुअली जब तक आप कॉन्फिडेंस क्रिएट नहीं करेंगे पेशेंट में और आप उसको अंदर से खंगालेंगे नहीं कि आपका प्रॉब्लम क्या है, जब तक पेशेंट भी नहीं बताएगा। क्योंकि पेशेंट बाज़ औक़ात बहुत ज़्यादा शर्मीला होता है, चाहे वो एलोपैथ के पास, चाहे हकीम के पास, होम्योपैथ के पास। लेकिन जब तक आप प्रॉपर हिस्ट्री नहीं लेंगे और स्किल्स आपकी नॉलेज में नहीं होंगी, जब तक आप नहीं कर सकते। तो मैं समझता हूँ कि आहंग जो है वो बहुत बड़ा काम कर रही है इस माशरे में। डॉक्टर्स को ट्रेन कर रही है, होम्योपैथ्स को, हकीम को, इंक्लूडिंग पैरामेडिकल स्टाफ हैं उनको भी, LHVs को भी, मिडवाइफ्स को भी।
मेरी जो है सेक्सुअल हेल्थ के बारे में कोई स्पेसिफिक नॉलेज नहीं थी। मुझे ये था कि बस वर्ड सेक्स, सेक्सुअल, बस इसमें ये कि ज़रा कुछ बताते होंगे सेक्स के बारे में ये हो। लेकिन जब मैंने ट्रेनिंग अटेंड की तो मुझे बहुत ज़्यादा मतलब नॉलेज मिला, बहुत सारे मिसकॉन्सेप्शन जो है क्लियर हुए मेरे।
जब शुरू की क्लासेस हम लोगों ने अटेंड की थी ना, तो बहुत अजीब सा फील होता था, ये इतना ओपनली, एकदम से इतना ओपनली आ जाना, फिर डिटेलली बात नहीं करना ना। तो फिर हम लोग आपस में मेरी क्लास फेलोज के साथ बैठे थे ना, डिस्कस करते थे कि ये एकदम से ये भी हो गया, ये भी बता दिया, ये भी बता दिया। लेकिन फिर आहिस्ता आहिस्ता ये था कि वो ख़त्म हो गया था, क्योंकि वो इतने अच्छे तरीके से, इतनी फ्रैंकली तरीके से हमें वो बताते थे, समझाते थे, तो वो फिर बाद में चीज़ें ख़त्म हो गई थी। यानी कि हमने एज अ मिडवाइफ हॉस्पिटल में भी इसको बहुत अप्लाई किया था।
I can say those who have attended workshops of the nature that we had with Aahung, those doctors certainly change.
Apart from the work being done by NGOs such as Aahung, the only real option for long-term sustainability for countering sexual health issues is the need for a more formalized role to be played by the medical institutions of Pakistan. Research has further shown that there is a direct correlation between the health of an individual and the economic prosperity of a country.
Three things always, they have very close relationship, like poverty, illiteracy and disease.
Sexual health has got a relationship with the economics and the development. How? Because the sexuality or the sexual health is related to the behaviors. And how these behaviors come, that behaviors has been felt, and people and an individual have got the thought of that behavior, and there are the sources of thoughts for that behavior. What are the sources of thoughts that behavior is the health, education, politics, economics, information. All these are the sources of the thoughts that have been affecting the behavior of the individual. If these sources of thought are positive, then the behaviors are positive. Then the people be able to practice the safe behavior, and they will be protected from the infection, dysfunction and the violence. And when they are protected from the infection, dysfunction and violence, then definitely the economy will go up of that particular individual. And if all the individual has been empowered by positive sources of the thoughts which will affect the behavior, then this leads to the population development. Then that will definitely affect the country by boosting the economical development.